guys, this is Dr. Herb. Today we'll look at the classification. So this is the classification of the vesiculobullous disorders. So first we are going to deal with according to the pathology. So according to the pathology, there is immunobullous disorders. There is immunobullous disorders, and there are primary blistering disease. There is primary blistering disease. There is primary blistering disease, and they occur due to the autoimmunity. They occur due to the autoimmunity. And first we will see the intraepidermal. So under this intraepidermal, there is pemphigus vulgaris. Next is there is pemphigus foliaceus. Next comes the pemphigus vegetans. And the pemphigus erythematosus. Pemphigus erythematosus. Next we go to the subepidermal. The subepidermal. So under the subepidermal, this includes the bullous. There is bullous, pemphigoid. Then comes the dermatitis herpetiformis. Next is epidermolysis. Bullous acquisita. Then we look at the mechanobullous disorders. So under this mechanobullous disorders, it is due to the defect in the structure of the epidermis. So the structure defect of the epidermis. So under this it includes, there is epidermolysis bulla, bullosa, as well as the bullous ichthyosiform erythroderma. Bullous ichthyosiform erythroderma. Now let's look at some other disorders. So now when we look at the other disorders, it includes, there are infections. Under infections, there is a VZV, there is a HSV, there is a bullous impetigo, and also the 3SSSS. Next is metabolic. Metabolic includes the porphyria, diabetes, as well as the hemodialysis. Next we look at the drug eruptions. So under the drug eruptions, there is a fixed drug eruption. There is fixed drug eruption, and also the Stevens-Johnson syndrome, SJS, and the erythema multiforme. there is erythema multiforme. Now we'll look at, according to the site, we'll see some classification. So first we are starting with the intraepidermal. So in terms of intraepidermal, first we'll look at the subcorneal. So the subcorneal is nothing but the granular layer. So what does it include? So the subcorneal or the granular layer, this includes, there is the pemphigus, foliaceus, and also the erythematosus. Next is the staphylococcal scalded skin syndrome, 4S. Then comes the miliaria crystallina. So miliaria crystallina. Then is the bullous impetigo. There is the bullous impetigo. Next, there is frictional blister. There is friction blister. There is subcorneal pustular dermatosis. There is subcorneal pustular dermatosis. Then comes the spinous layer. There is spinous layer. So this involves, there is S. zymatus. So eczematous means it is atopic dermatitis. Then there is also the HSV, VZV, and the VZV infection. Next comes the molluscum contagiosum. Then there is the familial benign pemphigus. There is familial benign pemphigus. So this includes the Hailey-Hailey disease. It includes the Hailey-Hailey disease. Next, we are going to look at the suprabasal. So in the suprabasal layer, there is a pemphigus vulgaris. This pemphigus vulgaris, as well as the Darius disease. Then we look at the basal layer. So in terms of basal layer, there is erythema multiforme, as well as there is epidermolysis bullosa simplex. Then we move on to the subepidermal category. So under the subepidermal, that is the dermoepidermal. So under this, it includes, there is a junctional, that is at basal lamina. At the basal lamina. So what does it include? It includes the junctional epidermolysis bullosa. So junctional epidermolysis bullosa. Next is the bullosa pemphigoid, and then the toxic epidermal necrolysis, that is a TEN. Then we move on to the dermolytic. So dermolytic is below the basal lamina. It is below basal lamina. So what does it include? It includes the epidermolysis bullous acquisita. Then comes the epidermolysis bullosa dystrophicaans. There's dystrophicaans. Then there is deep burns, maybe due to deep burns, as well as in terms of the porphyria, there is porphyria cutaneous tarda. So this was about the classification of the vesiculobullous disorders. So to learn and grow daily like this, please do subscribe.